Small businesses and cyber attacks. What do they all have in common? They are each feeling the effects of an ill-conceived law, Obamacare. Patients with pre-existing diseases now have to pay for expensive drugs out of pocket. Why? Something called closed drug formula. If their medication isn't on a list, the Obamacare government list, tough luck. Meantime, small businesses continue to struggle with Obamacare. Example, Utah. A small computer company has had to give the bad news to its employees.
Ogden business owner Chad Ney was shocked when he found out just how much the cost of his group insurance plan was going up under the Affordable Care Act.
As a small business owner, under 50 employees, the group plan underneath Obamacare tripled as far as price goes of what it would cost me to cover us as a group.
The increased cost wasn't an option, so he decided the best way was for the entire crew at Superior Computers to individually go to the federal marketplace, healthcare.gov, leading to even more challenges.
Now I've got to figure out a way that, how do I help my guys pay for their private insurance they had to get through healthcare.gov.
Oh, but there's more. To add insult to injury, cyber attacks on the healthcare sector are becoming a bigger and bigger concern. Why? The government website is a disaster, among other reasons. So, how vulnerable are the healthcare exchanges? Joining me now, private medicine advocate and Obamacare expert, Patricia Newman.
Hi, Greg.
Patty, hi. We have seen and heard about this before, the possible cyber attacks. Right. Is the healthcare industry more vulnerable than just a regular business?
Well, they're being targeted more. So for the first time in history, they keep track of how many cyber attacks are aimed at a certain industry, and the business industry used to be the top of the ladder there. But now, for the first time this last year, healthcare data was the highest targeted. So while business data was targeted 33.9% of the time, 43% of the time it was healthcare data that was being targeted. Now, that doesn't mean that it's less secure, because, in fact, when the businesses were targeted, 87.1% of their data was actually exposed, where in the healthcare industry, only 8.1% actually got exposed. The figures are kind of tricky, because this doesn't count all the possibilities of hacking into the exchanges. I don't know if you remember, but the House of Representatives tried to pass a law, H.R. 8311, and they tried to make Health and Human Services report any breach. Well, it's been in committee, past the House, but it's been in committee since January 14th in the Senate, and I don't think it's going to move from there. In fact, Obama said he didn't think that was, that was a good idea, because it would take all this paperwork.
Yeah, well, I'm sure Harry Reid and company has clogged it up in the Senate, and it'll probably be tabled indefinitely, unfortunately. So this may seem like a rather naive question, but I'm rather curious. I know why the federal government wants all this data from us, and that's to use it against us at some point in terms of, garnering it from healthcare and Obamacare. So why would these hackers, why are they so interested in Obamacare information?
Well, because it's a treasure trove. I mean, it has everything. Your medical records not only have your medical data, but they have your name, your date of birth, your social security number. They have what ethnicity you are. I mean, these are mandatory questions, except for the social security number, actually. But most providers do ask for that number. Patients need to know they don't have to give that number. Right. So, you just have to be smart with that. But hackers, they don't deal in your regular business. So you got to remember, there's also narcotic data. There was a case with HealthNet in particular, where the physicians themselves, their information was breached. And the problem with that is now they have the physician's name, they have their DEA number, they have their license number, and they could literally impersonate a physician and start writing, narcotic prescriptions.
Or how about extortion? I mean, let's say that a person suffers from AIDS, or maybe had gonorrhea or something like that, or maybe takes prescription medication for depression. This hacker could say, hey, I have this information about you, and I am going to make it public if you don't blank.
Well, you know who else has that information other than the hackers? It's the government has that information. And I had this conversation with this former Speaker Gingrich back in 2009, where he was promoting all the centralization of the electronic health records. He was making $1 gazillion going around talking about the subject. And I asked him in one of those seminars he was giving, I asked him, do you realize that this data could be used by either party to attack a new candidate if they have some medical history on them? And his response was, well, we could just make it a stronger penalty. It'll be a felony.
Yeah.
And I told him, well, what if the server is in Malaysia? You have no authority over a server somewhere else.
Gingrich is out of that now, right? Didn't he?
He's out of that. Yeah. Oh, yeah.
Now, I want to show you a piece of video before we run out of time here. Okay. It's Charles Barkley interviewing the president. Roll tape.
Does it ever happen to you, Chuck? You wake up and something hurts and you don't know exactly what happened, right? When you were
Everything hurts when I wake up.
When you were young, you had to actually have an injury before something hurts. We'd like to encourage more young people to sign up, partly because since they're healthier, their premiums are actually generally going to be fairly cheap. They can find good options for less than their cable bill, less than their cell phone bill, and it's just part of growing up.
Well, I don't know. Was it a softball interview by Sir Charles? Because I think he calls himself a Republican, even a conservative. It's kind of an odd interview there. It's
very strange. I saw the reaction in his face, and it was kind of shocking. He asked him if he liked the law being called Obamacare, and of course he does. He reminded me of a third world dictator, because that's what they like. They like their picture all over the place, the Kim Jong-il type. I mean, it's just such a third world attitude.
Oh, yeah. He's going to spin it. He thinks the history books will reflect positively on Obamacare. He's 100% wrong.
He
Patty,
will be wrong.
Thank you.
Thank you.
Coming up next, politics, polling, and presidential contenders for 2016 as the Daily Ledger continues.